Breaking down universal healthcare, a balanced hybrid model. Healthcare in the United States is at a breaking point, financially unsustainable, plagued by inaccessibility, and dominated by profit-driven corporations that prioritize their bottom line over patient well-being. Millions of Americans face medical bankruptcy, ration medication, or avoid seeking care due to exorbitant costs. Meanwhile, the insurance and pharmaceutical industries continue to exploit a system that prioritizes profits over public health. To address these systemic issues, we propose a hybrid universal healthcare system that guarantees universal access to essential medical services while maintaining competition and choice for elective and specialized care. This model ensures that all residents, including immigrants and refugees, receive basic, preventative, and emergency medical care without financial barriers. At the same time, it preserves the role of private insurance in covering non-essential and elective treatments, creating a balanced, consumer-driven system that lowers costs, prevents corporate abuse, and ensures long-term sustainability. This breakdown outlines why these changes are necessary, how they will be funded, and the policies required for successful implementation. By reforming the system with cost controls, sliding scale contributions, and corporate accountability measures, we can create a healthcare system that works for everyone, not just the wealthy or insured. Why this is necessary? Healthcare in the U.S. is financially unsustainable, inaccessible to many, and controlled by profit-driven corporations. A hybrid system would provide universal access to essential care while ensuring competition and choice for elective and specialized services. This prevents corporate price gouging, reduces medical bankruptcies, and protects vulnerable populations without eliminating private insurance. Universal basic health care, fully covered for all residents. Essential healthcare services would be free at the point of service, ensuring all individuals, including immigrants and refugees, receive necessary medical care. This includes preventative care, annual checkups, screenings, immunizations, nutrition counseling, and early interventions. Emergency and urgent care. No patient should ever be denied life-saving treatment due to cost. Chronic disease management, diabetes, hypertension, asthma, and other long-term conditions receive proactive management to prevent complications. Mental health and addiction treatment, coverage for therapy, psychiatric care, crisis intervention, and rehab services. Maternal and child health care, pregnancy care, labor and delivery, pediatric wellness, vaccinations, and postnatal support. Basic medications, essential drugs like antibiotics, insulin, and other life-saving generics. How this is funded. A small progressive payroll tax, offset by eliminating expensive private insurance premiums. Reallocation of existing federal and state healthcare budgets toward direct patient care. Cost savings from preventing expensive hospitalizations through early intervention. Elimination of waste, fraud, and administrative bloat from insurance bureaucracy. Sliding scale for high-cost, life-saving treatments. Instead of making all treatments free, which could be economically unsustainable in the short term, certain high-cost but necessary medical procedures would be affordable based on income until the need for them is significantly reduced through preventative care, innovative treatment research, and breaking pharmaceutical monopolies. Who pays what? Low-income individuals, heavily subsidized or fully covered. Middle-income individuals, pay a reduced rate. Higher-income individuals, pay more but still below today's private insurance costs. Out-of-pocket caps, no one should go bankrupt from medical expenses. Treatments under this model. Dialysis, cancer treatments, chemo, radiation, immunotherapy, organ transplants, gene therapy for rare diseases. Other high-cost, medically necessary treatments. How this is funded. Cost sharing based on income, not insurance loopholes. Tax revenue from luxury goods and non-essential services to supplement care funding. Ending big pharma price gouging to lower overall treatment costs. Insurance covers elective and non-essential medical services. Insurance companies would not control life-saving care, but they would compete in a private market to cover non-essential services. This keeps consumer choice intact while ensuring basic healthcare isn't dictated by corporate interests. Gender-affirming surgeries and hormone therapy. Elective surgeries, cosmetic, LASIK, fertility treatments, etc. Private hospital room upgrades and luxury care. Alternative and holistic medicine, acupuncture, chiropractic care, etc. Premium prescription drug coverage. How this is funded. Private insurance premiums, with greater competition driving down prices. Tax-free employer-sponsored healthcare remains an option. Public option insurance could be offered as a more affordable alternative to private insurance. Breaking the pharmaceutical industry's stranglehold. Affordable alternative to private insurance. The big pharma monopoly has suppressed effective treatments for decades, prioritizing profits over human lives. A regulated, transparent system ensures that patients receive the best available treatments, not just the most profitable ones. Regulatory reforms to prevent corruption and monopolization. Price caps on essential medications to prevent unaffordable markups. End patent loopholes that allow corporations to block generics. Fund alternative medicine research to find cheaper, non-pharmaceutical solutions. Ban pay-to-delay schemes that prevent life-saving drugs from entering the market. Increase transparency in drug approval processes to stop conflicts of interest. How this is funded. Fines and penalties on pharmaceutical companies engaging in price gouging. A public R&D fund for holistic medicine and alternative treatments. Negotiated drug prices, like the VA model, for government-covered treatments. Ensuring cost control and program sustainability. Public-private partnership for research and development. Collaboration between universities, private sector, and government research facilities ensures that medical breakthroughs remain accessible rather than monopolized. Fraud prevention and AI-powered auditing. AI and blockchain tech can prevent fraud, track medical billing, and reduce unnecessary administrative overhead. Medical Debt Forgiveness Program, a one-time medical debt relief fund to help transition into the new system and prevent lingering financial ruin for millions of Americans. How we implement these changes. Policy reforms. Pass Universal Healthcare and Sliding Scale Treatment Act to ensure fair healthcare pricing. Strengthen antitrust laws to prevent monopolization of medicine. Enforce price transparency laws so patients know costs before treatment. Legislative actions. Medicare expansion bill covering all citizens for basic care. Pharmaceutical reform and price cap legislation. Revised private insurance regulations to force competition and coverage guarantees. Funding sources. Payroll tax, lower than private insurance premiums. Luxury and non-essential goods tax. Public-private research grants. Ending unnecessary corporate tax loopholes. Final thoughts, a healthcare system that works for everyone. This hybrid model ensures that everyone has access to basic and preventative care. High cost, life-saving treatments remain accessible and affordable. Insurance focuses on elective procedures, making it a competitive and consumer-driven market. Pharmaceutical companies are regulated to prevent corporate exploitation. Medical debt and price gouging become things of the past. This is how we move toward a healthier future, one where healthcare is a right, not a privilege. Conclusion. A hybrid universal healthcare system is the most pragmatic and sustainable approach to fixing the current broken model. It ensures that everyone has access to essential healthcare, while high-cost treatments remain affordable through income-based contributions. This structure allows private insurance to compete for elective services, keeping the market dynamic without compromising public health. By regulating pharmaceutical companies, removing price gouging tactics, and shifting funds away from corporate profit margins toward direct patient care, we can reduce medical bankruptcies, improve health outcomes, and ensure fair access for all. This system is not just an idealistic vision. It is a necessary reform to build a healthcare model that prioritizes people over profits. With proper funding mechanisms, strict policy enforcement, and legislative support, this model can transition the U.S. into a healthcare system that delivers quality, affordability, and universal coverage, where healthcare is a right, not a privilege.